Well, welcome. Tonight we have a new person that we're going to get to know. Somebody who we're really counting on to help Milford and continue our growth and just be part of the Milford family. Why don't we start with an introduction?
Thank you so much, Al. It's so great to be here with you. And thank you for having me, particularly on this 700th episode of this amazing show. I'm really, really honored. I am State Senator Rebecca Rousch. I am currently serving in my second term in the Senate. And I am a married mom of 2 kids under 10, one of only 2 moms of kids under 10 in the whole Senate. Next session poised to be the only mom of kids under 10 in the whole Senate. I'm a lawyer by training, turned lawmaker. Never thought I was going into politics. And now that I am here, life sometimes takes interesting turns. Now that I am here, I know I'm in the right place. And we've had such tremendous success on so many different things, just trying to make lived realities, people's lives a little bit better in lots and lots of different ways, big and small. And so it's been a real honor and privilege, the biggest privilege of my career, to serve in the Senate, to deliver really revolutionized service to the people and municipalities that I represent, especially because of the pandemic. And I'm really excited to keep doing this work for many years to come.
Before we get into the politics, now you have a 10-year-old and
I have a 6-year-old and an almost 8-year-old.
Oh.
And it's so funny, Al, because like I said, I never thought I was going into politics. This was not what I set out to do with my career, right? I went to law school to learn how to use the law as a tool to advance, changes that improve people's lives. But I never thought that I was going to be in electoral politics or become a politician myself. But my kids, because they're so little, they have no memory of me pre-Senator Mommy, right? They only know me as Senator Mommy, which is adorable and also kind of just strange for me because there was whole swaths of my life, obviously, before they were born. But anyway, they are in kindergarten and second grade, and they know a lot about civics.
well, you never know. I mean, I remember the first time I took my youngest to the Louvre, and she was 10.
Yeah.
And she starts giving me a lesson on the Impressionists.
Oh, really?
And I'm looking at my darling bride saying, who is this kid?
They learn things everywhere.
Of course, I don't know how you can have 2 kids and a senator's role, how you keep up.
Well, I'll tell you, I have a really phenomenal husband. I have both my parents are still with us, and my mom in particular has been just a phenomenal help at basically every turn, and a really incredible network of people who help and support. On my first campaign, we had people volunteering to take care of the kids while I was out knocking doors, and also many Google calendars. No. And that is how it works.
I was going to say, I mean, this is terribly sexist, so I apologize, but being a dad of 2 girls is so much easier. I remember when they hit high school, girls somehow, and I mean, again, I apologize, but they take care of their old dad.
Oh, well, that's nice.
Even today, we have a totally dysfunctional family. We don't do anything unless we're together.
I mean, that sounds kind of nice.
Oh, I love it. It just when you sit there and people say, well, how often do you see your grandkids? Not enough, like 3 times a week, 4 times a week.
Oh, wow. My parents will be very sad when they hear this recording because I grew up in upstate New York. I came to the Boston area to go to college. I stayed for law school. I was working here for a long time. And then we went out to the West Coast for a couple of years. I went back to school and I was teaching at a university out there for a couple of years before we came back to the area. But my parents are still in upstate New York, and it's not too far of a drive. It's less than 3 hours each way. But they definitely don't get to see their grandkids, 3 times a week.
My oldest, ungrateful offspring number 1, is 1.5 miles away.
Well, that is very close indeed.
And then we cheated by, when she wanted to start working out, we put a gym in the basement.
Oh, that's sneaky.
And what we've learned is the grandkids can't go down there while they're working out. So they force us to play with the grandkids while they work out.
It sounds like it works well for everyone involved.
Yeah.
Yeah.
Of course, the youngest moved all the way to Boston,
Oh, very far.
so we only see her every other week. And
Mm-hmm. It is not far. I mean, like in the grand scheme, but it's also not close either, right? I
no,
mean,
it's
Milford
close
to
enough
Boston
for
is,
her. She's got her independence.
yeah.
But when I see my darling bride working full time
Mm-hmm.
and what she used to do, because the kids were great when they wanted fun, they were with me.
Yeah.
When they were sick or needed, somehow that always gravitated. They gravitated towards their mom.
Sometimes you just need your mom.
That was it. So
Yeah.
I just shook my head because when I was coaching soccer, I was always amazed when I saw how many single moms
Mm-hmm.
with 1 and 2 kids
Yeah.
survived. Because we had my mother, the kid's grandmother, living with us.
Yeah.
So it was 3 against 2. We almost evened the score.
Yeah, it definitely is tough. And as I go through this work, with this tremendous opportunity to help people, especially as a parent myself, single parents have all my respect. And, as a mom of young kids, I've been able to work hard to elevate the issues that come up for parents of young kids, because I am a parent of young kids, and so I'm living those issues too, right? I have a bill right now actually that has first term. It's a brand new bill, not my first term, but the bill's first term. And it already garnered a favorable committee report and is moving along in the legislative process to help people get to the pediatrician. Because some of our insurance companies cover well-child pediatric appointments once every 12 months, right? Which for all intents and purposes is 12 months plus 1 day, right? So
Right.
if you go on January 10th 1 year, your next available coverage, right, for the insurance company to cover you for the cost is January 11th of the following year, right? Other insurance companies, lo and behold, cover a well-child visit once per calendar year, right? So you can go anytime you want in 2022, anytime in 2023, et cetera. But especially because of COVID, so many pediatric appointments got delayed, right? If it's every 12 months plus 1 day, people can never get back on track, right? You end up having their annual checkup, 6 months after the kid's birthday. And that doesn't really help anybody involved, and it's really frustrating and difficult for the parents. So I have a bill to require insurance companies to cover once per calendar year. It doesn't change anybody's bottom line, but it drastically helps families get their kids to the doctor. Just making life easier, just a little bit, in ways that are, that make a difference in the way you live your life.
Those little things don't seem like a lot, but to the parent who's trying to juggle 2 kids and
Yeah, 2 kids and work and all the rest, it's a lot. And
Well,
so, this is just one way that I'm working to make it a little bit easier, a little bit better
everybody
for
that's
everybody.
watching should understand that you're not our senator yet,
True. That is true. That is,
but
yes.
you're already in Milford. I've seen you a couple times around. You're already trying to make a mark in Milford.
Well, I really wholeheartedly believe in stellar public service. And the only way that we can really do that is to be in community, right? And learn about Milford, right? From Milfordians such as yourself. And, and your state rep, fantastic state rep, Brian Murray, is a good friend. And, he and I talk all the time. And, I'm learning, and I want to be able to provide. And folks can reach out to me now. It is true, I'm not yet your senator, but I sure hope to be starting in January, which is when the new district lines will kick in. And and I'm ready to really hit the ground running. And I have to say, I'm really looking forward to Milford Days coming up.
So
in May.
come November, we have an election.
Yes, we all do.
Fundamental question, Becca. I'm from Milford. Why should I vote for you?
Well, because I am a proven leader with the experience and the expertise to deliver results. And in fact, I've been delivering results since before I even was sworn into office. And you can see it in every part of the district that I currently represent. And you can see it even now as I'm here. I've been here in Milford. As soon as I knew that Milford was coming into the district, I said, all right, we're going to go get to know Milford a little bit and learn how I can best serve the people. And my team and I work really hard. Doesn't matter how big or small the town, but to make sure that we are here and we are listening and we're in community. We provide opportunities to, reach out to us and to listen and learn and provide the kind of service that everybody deserves. And we've been able to really deliver. And, both on the ground, for people's individual concerns, for municipal level concerns, and particularly unemployment throughout the pandemic. I mean, we've helped so many people. And that's the job. And that's, none of us got into this because we wanted to be politicians or work in electoral politics.
It's not the $1 million salary.
Yeah, it's definitely not for the money. We got into this because we wanted to do some good in the world. And we've been able to do that both in that personal service and also funding, millions and millions of state dollars brought back to the municipalities that I represent on everything from libraries and accessible playgrounds to water infrastructure and, communication systems. And schools, right? I mean, schools and all sorts of things, right? And there's so many different pieces at the state level. And, as a lawyer who worked in both the private sector and the public sector before I was elected to serve in the Senate, I bring all that experience to the table. It's why my legislation is able to advance, because we do our homework, because we show up prepared, because we listen to the people and the experts and take their advice and then turn that advice and their insights into policy change.
Well, my hat's off for what you all did this year for school.
Thank you.
When the initial school budget came in, I have to admit, my heart stopped for a few beats because the school came in. It's always hard because our school committee are Milfordians. Mm-hmm. They really do understand the balance that we have to have between funding the young kids and not chasing away the people who built this town. Mm-hmm. But when they said they needed $6 million, my heart stopped. It's like, when am I going to come up with $6 million?
It's not a small amount of money, yeah.
But then the rumor is that y'all have passed, well, went through the governor already, that we're going to get an extra $7 million to address our school, which is fantastic.
Yeah, I'll tell you, honestly, I haven't seen the numbers yet, but we are in the middle of phasing in the Student Opportunity Act, and that delivers an increase on a variety of fronts to schools all across the state. So that is certainly a piece. And, we weren't actually hit as bad financially during the pandemic as everybody, myself included, was worried that we would be, but we've been sort of pleasantly surprised that the hit has not been nearly as substantial as we thought it was going to be. So we have been able to continue funding.
Well, we heard that the three priorities were towns that have high low-income population, towns that have high immigration, and towns that have high special needs.
Yes, all three of those are pieces of the Student Opportunity Act.
And all three of those are Milford.
Are really central to Milford, yeah. So students who are learning English as a second language, that's a component, low-income students, and special education, and also there's a piece a piece of the Student Opportunity Act that's directly targeted to supporting student mental health, which particularly now is a really big concern. It's another thing actually that is one of my success stories. In fact, it launched today, so our timing is impeccable. But I hold a regular, what I call Students Speak. It's a town hall just for young people in the district.
Hot dang.
And thank you. And because we wanted to listen, right? We wanted to listen, and we identified this group of people who are the leaders of both today and tomorrow. And we said, we need to make sure that we're giving space, right? We grown-ups sometimes take up the space. We wanted to make sure that we were providing space specifically for young people to engage with me and my team. So we did it. We've been doing it virtually because of COVID. But what we've actually found is, young people don't necessarily drive, right? Doing something, right? If you're 13, you're not getting behind a car, right? So having it virtually has really allowed participation from all sorts of different places throughout the district without having to have anybody drive you or, figuring out pickup or all the rest of it. And the students have come. And in the very first instance of Students Speak, we had a room, a Zoom room full of young people, and they were incredibly articulate and very clear that they needed better mental health supports. And, in a way that was far more self-aware than I certainly was as a teenager. And my team and I looked at each other afterward and we said, okay, how can we deliver on this? And so we got on the phone, we did our research, we talked to some experts on providing mental health support. And today, I secured through the budget within months, right? I mean, a matter of weeks, really, $250,000 to launch a pilot program for a mental health support text line that's geared specifically to youth, so that young people have help just a text away, right? Because you got to meet young people where they are, and a lot of them are texting. So, we worked with Samaritans, which is a nonprofit organization, to build this. And today, they launched the text line designed specifically to support young people with whatever is feeling stressful or concerning in that moment. It's called Hey Sam. Hey Sam, and you can just text over to Sam, and and one of their trained support folks will respond, and that's the kind of change that I deliver.
Fantastic on so many levels.
Thank you.
I mean, it kills me when we've had elections where we had 12% participation of voters.
Yeah.
And you sit there and say, well, how do we get kids involved early in the process so that they stay?
Yeah.
And programs like you're talking about are the first step to getting them involved.
Yeah, the students speak, and I go into high schools and talk with kids. I talk with kids actually at all different ages. And I think that's also part of, of being both a former informal educator, right? I was never a licensed teacher in the public schools or anything. But I've done education work in sort of different capacities. And also just being a mom and somebody who cares about kids, you sort of listen and learn and figure out new and innovative ways to bring people into the fold. And so Students Speak has been this really, really successful program that we certainly intend to continue going forward, and has been wildly successful so far, and has quite literally yielded results in less than a year.
But more importantly, you're planting the seeds, in my mind, to get these kids to participate in the process for decades forward.
I hope so. It's also why we bring on high school students as interns into my office, and and try to provide that kind of exposure to how government works. And also why I go into the schools and talk with students in their, particularly in the high schools, to just, I'm your state senator, and also I'm a normal person, right? Like, I'm just a person like everybody else, and this happens to be my job. And we definitely are dedicated to helping young people engage in government and civics and education and elections.
So now you cover 11 towns?
The district, with the shifting that happened through the redistricting process that's bringing us together today, yes, there will be 11 towns in the district, and I can name them all for you if you'd like.
Yes, please.
Okay, here we go. Needham, Dover, Sherburne, Millis, Medfield, Norfolk, Rentham, Plainville, Franklin, Bellingham, and Milford.
So it's a reasonable district.
Yeah, well, it's been described, the shape has been described to me in a couple of different ways. I've heard it described as sort of a miniature Italy, like it looks a little bit like the boot.
The boot?
Yeah. Some people have described it as like a fish hook, right, because it scoops up into Milford in that southern part. But, whatever the shape is, 11 towns, the entirety of all those towns. Milford, Franklin, and Needham are the biggest by population. But like I said before, my team and I are dedicated to really, connecting with folks everywhere.
Now,
in the
600-pound gorilla that Milfordians are going to be embarrassed to ask, but how does Milford fare in this new district? We used to be the biggest town, so we got a lot of attention from our state senator and our state rep.
Yeah.
Well, Brian had no choice. He's a Milford person.
Well, I'll tell you, Brian, so like I just said, Milford is one of the 3 biggest towns in the district. But to me, size doesn't matter to me. I think that every single town deserves stellar service, regardless of whether you have 2,000 people or 25,000 people, or in Milford's case, even more than that. So, I have a member of my staff who's my director of internal external relations. She meets monthly with every single town administrator or manager, routine. One of the things that I am trying to increase is having routine calls with members of select boards all throughout my district, just to touch base. How you doing? What's going on? One of the most important pieces, I think, of making sure that that we're in touch with everybody in the district is the communication with the state rep, right? So Brian and I are already working as a team in a whole variety of ways. And that Brian, right, as you said, Brian lives here, so he certainly has a sense of what's happening in Milford more than I do. And then he gives me a call or shoots me a text message and says, "Hey, Becca, we gotta, you should know about this thing that's going on, or there's this piece of funding that we're gonna try to get, or whatever the issue happens to be." And then we work together as a team to really deliver on that. And that's been, wildly successful so far. And the other thing, similar to Students Speak, is that we hold office hours that are available for anybody in the district. Milfordians are more than welcome to come now, even though I'm technically not your senator yet. We do them virtually, so you don't have to come into the State House or drive to wherever it is in the district that we're, where we happen to be hosting office hours that particular day. But you can go right online to our website, beccarouschma.com, and book an appointment for our upcoming office hours. We're starting, now that, the COVID numbers are moving and hopefully staying in the right direction, we're getting back into senior centers, and we're able to, connect. I was just today in Wrentham at a rest home in Wrentham, connecting with some of our older adults who are living there. And I'm a healthcare attorney, so I'm also able to help that rest home in a really sort of detailed and nuanced way on the administrative side, right? Because I understand all the in and outs because of my work as a lawyer in that space. So, that's how I come in, right? I come in with earnest and compassion and an ear and a savviness for being able to get things done and actually delivering.
Now, you've got a challenge that I don't know that a lot of the senators have. Because when I think of one end of your district being Dover-Sherburne, not the poorest area in the...
True.
And then you've got places like Milford, which Brian brought up. I had never heard it used, gateway town. Because we're not a gateway city like New Beige or Fall River.
Right, Attleboro, yeah.
But we have a lot of the same issues. I mean, I was stunned when I found out that almost 50% of our high school kids are on free lunch program.
Well, I mean, this year everybody's getting free lunch, which is a great thing, and it has done, phenomenal things to improving food security in all sorts of ways. I serve as the Senate chair of the Joint Committee on the Environment, Natural Resources, and Agriculture, and so food and food systems, right? Where does our food come from? How much of it is coming from Massachusetts? How do we deliver food? Has actually been a really big part of
well,
my
I'll
work.
interrupt. You want to learn the words Carla Tuttle.
Okay.
Olivas.
Oh, I've been there, and the olives are awesome.
I was going to say, one thing that we're always comfortable with is that if there's something to do with food,
Yeah.
our kids are taken care of.
Yeah.
I don't know how she does it.
Yeah.
Frankly, don't care. But the Oliva family and Carla specifically
Yeah.
have been taking care of our kids for a long time.
That's tremendous work, and it's such a staple of the community. And I have to tell you, the first time I went to Oliva's, my husband loves olives. I mean, loves them. And so I bought him like a small container of the garlic stuffed green olives to take home, just as a little present. I might have, he might not have been able to consume the whole container because I might have needed to share that.
You had to do quality control?
Yeah, quality control. Let's call it that. Oliva's a fantastic market. And, and Oliva's is one of those places that really shows you the heart of Milford. And, so I walked in, And I spent, half an hour in there just kind of walking around, getting a feel for the store, getting to know the people and talking to the folks in there. And it was wonderful and also delicious. But yeah, to your question about, gateway cities, I mean, I represent a gateway city now. Attleboro is part of my district currently. And, one of the things that when you have a district as diverse as this one, at least in terms of finances, I do a lot of listening. And what I have found consistently, going all the way back to when I was first running for this seat, is that the top line issues are really the same. Everybody's worried about your kids not being able to afford a home in the community where they grew up. Everybody's worried about seniors not being able to age in their community of choice because our property prices are going up. Everybody's worried about education, right? Now, that manifests differently, right? There's some certain schools are, trying to make sure that they have sufficient funding for, AP classes or various things. When I will never forget this for the rest of my life, but I was talking to a parent in the southern part of my district when I was first campaigning, and she said that her son never got the textbook, right? Never got the textbook for the course that he was taking in high school because they didn't have the money to give it to him. And so he couldn't read the book, so he couldn't learn the material. When it came time for the test, he flunked the test because he never had the book in the first place, right? That's not how we deliver on our constitutional right to a free and appropriate public education. That's just not how we do it. And so passing that Student Opportunity Act in my very first term was a really, really big deal, right? And so everyone was looking for different, supports for education. Everybody's looking for, more affordable health care. Particularly right now, everybody's really focused on public health. And everyone's looking to make sure we're supporting our small businesses, myself too, right? That Olivas, right? This is where you feel community, right? And public health ties into that, right? Because people feel more safe and confident, they're going back out into businesses.
It's always amazing because the one thing that I've never worried about is we've got a fantastic town meeting. Mm-hmm. 200 plus people.
Yeah.
Who know, who feel,
right,
who act in the best interest of Milford.
Yeah.
I've never seen somebody go up and say, our kids need this. Now, there's always they want that.
Well, they are kids, so they want lots of things.
But I mean, even our school committee, again, I remember back Romney days where our budgets got really hacked.
Yeah.
And we had to go to the schools and every other department and say, guys, please don't argue the merits of your requests.
Right.
We're talking about what we can afford. It's wrong.
Yeah.
But this is what we can afford.
This is what we've got, yeah.
The unions of Milford public school teachers came to us and knocked me over.
Yeah.
Because instead of like other towns saying we'll defer our raises, they literally came and said, if you keep the money in the school district to save teachers,
yeah,
we'll forego our raises.
That's incredible.
And you sit there and say, that's not the picture that you get of unions.
Yeah, yeah.
And
teachers are incredible folks, and they have really done Herculean work. I mean, all the time, but especially in these last couple of years.
But it's just when you're really stretching them thin to begin with.
Yeah.
And then without asking. Because on the FinCom, we were sitting there saying we're in deep trouble.
Right.
And it wasn't that made or break the year's budget.
Sure.
But boy, did it send a message across every department.
Yeah.
That if the teachers are willing, because they're usually the toughest bargainers, them and fire, if they're willing to forego,
yeah,
to save people,
right,
shouldn't we all?
Right. Yeah. Thank you, teachers.
Exactly.
Yeah, absolutely.
Now, you're a mom. Kids
Indeed.
in school.
Kids in school every day. Drop them off.
Talk to me about how we doing really on COVID.
Well, I just looked at the numbers, and it's I haven't seen new numbers come out on Thursdays, so we'll see how those come out. But um, they've been dropping, which is very encouraging, and and hopefully they'll stay there, right? We know, right, the most common sense thing to do in a public health crisis like COVID is to listen to the public health experts, right? So when they said, everybody get vaccinated, okay, everybody
We
put on a
went out and
mask,
got
okay,
vaccinated.
right? You go get vaccinated, you put on your mask. So the CDC has now issued new guidance relatively recently that if you're vaccinated and your risk is low, unless you're in a setting where other people are at risk or you might be at a heightened risk, you're probably okay to go without a mask, right? We're having this conversation maskless tonight. Um, and even in the state house, right, the mask requirement has come down because the numbers have gone in the right direction. What we also know, though, is that we are definitely still susceptible and at risk for another variant. We all saw how fast Omicron and seriously Omicron just ripped through us, right? I mean, the numbers went through the roof really fast. So we need to be prepared, right? We need to be prepared for the next variant because almost guaranteed something will come, or so that's what the experts are saying. So we need to be ready for that, and the best way for us to be ready for that is to get vaccinated if you haven't, right? And get boosted if you haven't. And when it comes time, for us to get more boosters, go do it. And that's part of
So
what
your
I've been working
position,
on.
to vax or not to vax?
I strongly support vaccinations in consultation with your physician.
And I am totally amazed at how many parents will tell me they won't vaccinate their kids, but the kids are in school.
Yeah.
So I sit there and say, to get in school, didn't we all get the MMR?
Al, I'm so glad you asked me this question, actually, because Massachusetts, this is a little known fact, but Massachusetts was the first state in the entire country to mandate a smallpox vaccine back in the 19th century. And now, here we are, one of the leading states in the nation in terms of healthcare. I hate to use the word industry, but the healthcare sector, right? And we don't even have a complete set of data on youth program vaccination and exemption rates. It's actually not true that all students in public schools have all of their vaccinations against measles and mumps and polio and whooping cough and all the rest. It's not. And in fact, and this is, the Department of Public Health does a terrific job issuing a survey every year that they put out to all the schools and all the daycares and all the colleges and all the summer camps saying, please give us this information. And it's a voluntary survey because there's nothing in our law, in our state law, that mandates it. Just the reporting, right? Not mandating vaccines, but just reporting the data. And so, 4 out of 5 youth programs respond to that voluntary survey, and to a voluntary survey, that's terrific, right? 4 out of 5 response rate, that's
great. You
great.
can get 80% response rate, that's amazing.
Exactly, except when you're talking about vaccines, because an 80% response rate is actually just a 20% incomplete data set, right? Especially when you're looking at measles, for example, that requires 95% vaccination in order to achieve herd immunity, right? To stop the spread of measles in a community. We don't even have the data. And so this is something actually that came up one of my kids when they were in their first year of life. There was a measles outbreak. And I'm a healthcare attorney and now also a parent of a newborn, and that was very scary. That's a scary thing for a parent. And so when I was elected, I kind of like lifted the rock and looked underneath as to what was going on with our immunization infrastructure, right? Our infectious disease prevention infrastructure. And I looked under and I said, oh wow, it's a mess all up in here. And so this is, one of the ways that I was able to bring my expertise as a healthcare attorney, and my own personal lived experiences as a parent, and the realities that have faced droves of parents, especially in the last 2 years. But this is actually something that I, drafted and wrote and filed before COVID, before PPE was a household term. To strengthen that infrastructure, to make sure that we actually get the data, to make sure that parents can access that data when you're making decisions about where we're going to send our kids for school or camp or what have you, and also provide some standardizing and consistency from town to town and city to city, even school to school, about vaccines and vaccination exemptions.
But it amazes me because the data,
Hmm.
we live in a state that's driven by the biotech industry.
Yes.
Okay, so anything going to market has to go through a phase 1 safety, phase 2, phase 3.
Hmm.
A lot of these drugs are tested on 1,000 people. And
I don't know the sample size, but
but
they are definitely
a lot
tested,
of them are
yes.
10,000.
Hmm.
But to me, the COVID vaccine
Yeah.
was the biggest clinical trial I've ever heard of in my life when you talk about 100 million people. So, when people sit there and say, well, it's never tested to be safe. 100 million people took this.
When I get these kinds of questions, I mean, yes, right? Millions and millions of people have been vaccinated. And we are still seeing, unfortunately, some inequity in access to that vaccine, in part because of sort of a really unfortunate spread of disinformation, and in part because people have 3 jobs or 4 jobs and need childcare, and so it's just been hard to get to that vaccine appointment and then come back 3 weeks later and come back to get your booster. But what I would say, to folks who have questions is to, go and talk with your medical provider and, somebody you trust who can give you some information, just facts, so you can get the actual facts. And there has been just an absolutely horrifying, rampant spread of disinformation, both about COVID itself and about the vaccine, that has done real harm to the people of Milford, to the people of our
Everywhere.
Commonwealth, to the people of our nation, of the world. And
I've never heard.
combating that is difficult.
I've never heard of a vaccine. If you say up until now it's been all pre-release, it's
Mm-hmm.
this would be the biggest clinical trial ever envisioned.
Yeah, this is definitely one way to look at it.
If you had come out and said we want to test 100 million people,
Yeah.
everybody would have told you should share the narcotics you're on, because there's no way you could ever fund it. But we did, and it
Yeah.
just, we had a situation where TB came to Milford. We had some immigrants from a part of the world where TB had not been eradicated.
Mm-hmm.
Our health board immediately rallied, asked for extra money
Yeah,
to have the visiting nurses make sure
that everybody had access.
that everybody had access.
Yeah.
And it was amazing because you get hit with well, there you go again, putting all this money towards immigrants and not towards our own kids. And one time I just lost it. I said, do you hear the words coming out of your mouth? First of all, they're children.
Mm-hmm.
We should take care of our kids. And if they're in Milford, they bleed Milford red, we take care of them.
Mm-hmm.
But secondly, do you have kids in school? Well, I have grandkids. I said, great. Guess who I'm protecting as well as the immigrant kids?
Yeah.
If I don't help these people get over this TB, they're going to go to school, and your grandson and granddaughter is going to be right next to them. So if you want to look at it as a positive, they're Milford kids. We take care of them.
Well, and that's something that I think we've seen really, a couple of points actually that I think have really risen to the surface, among many others, during COVID, is that we rise or fall together. We are all in this together. I mean, for Pete's sake, we live in a commonwealth. We are in this together. And when we uplift the people with the least access, the people with, the people who are facing a hard time, we actually uplift everybody. And, and this real sense of community and caring, I think is so very important, and has, I think, kind of fallen to the wayside, but we're seeing now just how important it is. And when communities are coming together and they're finding that unity, that cohesion, that's where you really see success. And frankly, we're also seeing just how important those public health nurses are.
Oh, God, yes.
Yeah.
But I find it amazing that somebody could say, we don't need to take care of these kids. They're not Americans. Well, first of all, I dare anybody to look at a child, have some little girl or little boy look up and say, Becca, would you help me? I'm sick. Could you turn your back on them?
I never would. I never would.
You know, we had Jeff Hopkins, the head of our ER here.
Mm-hmm.
He said, I have never asked anybody Visa or MasterCard when they come to my emergency room.
Right. No, you just treat.
He says, I take care of kids. I don't care where they're from, how they got there.
Mm-hmm.
I take care of them.
Yeah.
And I mean, realistically, I don't want to know of anybody who could look at a sick child and turn their back.
Well, you know, I think communities are especially these days, are growing and changing, and you know, and we see readily in lots of places that you know, immigrants are part of the fabric of our communities, and you know, and again, we all come together, and we all you know, I've seen great appreciation for lots of diversity, and you know, learning about each other, trying each other's foods. I mean, all sorts of good stuff. And we rise or fall together.
And, you know, I'm here because somebody in 1939 in Milford
Yeah.
helped my grandfather assimilate.
Yeah.
So when I help others, I'm just paying back an old debt. I'm not doing anything special.
Yeah, I am. I too am second generation American. My grandfather was a Holocaust survivor, and after quite a long time trying to get here, he eventually made it here, and you know, and he was here for a very short time before he enlisted, turned around, went back to Germany to fight against Hitler and the Nazis, and you know, we all came from somewhere else. Or almost all of us came
One
from
of the
somewhere else
things
at some
that
point.
we see on your website and everywhere is the attention you want to spend towards universal health care.
Mm-hmm.
Don't we already have it?
Oh, I wish we did.
No,
I
but
wish we did. But we don't. We don't, because, you know, I hear from people all the time. In fact, the Senate just passed a bill. We just passed a bill on pharmaceutical pricing, right? And one of the things that was a piece of that bill was to cap
Insulin?
cap the out-of-pocket costs of insulin to $25 for a 30-day supply.
That would be wonderful.
Wouldn't it? And we also, in that bill, created a trust fund to support people who are unable to pay for medication for chronic conditions like asthma, for example. Because nobody should have to choose between their meds
And eating?
and food, or their meds and heat, or their meds and, you know, you name it, some other, any of other of life's necessities. But that is where we are, right? And people are I hear this pretty regularly from folks that they are really concerned about the rising cost of healthcare and the rising cost of insurance. And, you know, and until we're able to actually make sure that everybody can just go to the doctor whenever they need to go, and they're not worried about, you know, attendant testing costs or, you know, medicinal costs or what, I mean, there are costs for everything. Until we can actually generate that, we're not there. We are not at universal
But
health
no,
care.
isn't the real argument when we pay and how much? Do we take care of somebody when they have the sniffles? Or do we wait till they have pneumonia?
Yeah, well, if you wait till pneumonia, it's going to cost a lot more,
Well,
and your
that's what I'm
outcome's going to
saying.
be a lot worse.
You know, when I think
Yeah.
about it, we argue that the emergency room costs are too expensive.
Right.
Well, if I have no insurance
Yeah.
and I can't afford it,
Right.
what choice do I have except to go knock on Dr. Hopkins' door and say,
Right.
my child is ill, help
Right.
me?
Right. Right. You know, and that's part of what led to the federal law that requires emergency departments to treat people, or all hospitals to treat people in states of emergency.
You mean they were being turned away?
They were, yep. They were being turned away. Some
I'm sorry to
awful,
be-
awful stories of patient dumping and other things because patients were unable to pay. And it's what led to a federal law called EMTALA, which is the acronym. But that's the legislation that actually requires a hospital to treat you if you show up and you're in an emergency, right? If you're having a healthcare emergency. But that doesn't actually answer that underlying question about, the cost of healthcare, right? We know that our costs of healthcare are drastically higher than basically every other, quote unquote developed nation in the world. And that's because we have our system for a very, very long time was a reactive system, right? You treat them, the sniffles are not such a big deal.
You wait till they get pneumonia.
Pneumonia,
and then you
that's
deal
a
with
big deal, right? You treat it at pneumonia, but we're missing the point, right? And I think our healthcare system in America, including in Massachusetts and including right here at home in our district, is now, shifting into preventive healthcare, right? It's less expensive and people stay healthy. Everybody's happy.
And I hate to be cold, but isn't it just the right thing to do?
I mean, I think so. And I think that most people agree that it is the right thing to do, is to just help everybody stay healthy. And it does cost less. The difference, and I think this is part of where, the conversation sort of, the devil's always in the details, right? So the difference is you're either paying the money to an insurance company or you're paying the money to the government, right? If we're going to provide universal health care, like, England, for example, right? The National Health Service in England, the taxes go up because you're paying for health care. It's the same money that we're paying to the insurance companies, right? So it depends on where your money is going to go. But this, I think, is part and parcel of the conversation that we're seeing unfold in a lot of conversations in our region and across the country, actually, about, how do we get there, right? How do we get there in a way that isn't going to put people out of work and is still going to deliver the results that we're looking for, right? So that we can treat people before it gets serious, and help people stay healthy in the first place.
Yeah, and the devil is in the details, because when we lived in France, I thought French socialized medicine was the best thing in the world because we had American Blue Cross.
Yeah.
So what took the French people, the friends of ours, took them months to get treatment. We got treatment in a week. So the system still had to be worked out.
Yeah, kinks in the system.
But the theory was that everybody deserves to be healthy.
Right. And, and it's always nice to know when your values align, right? That everybody deserves to be healthy. That's a value statement, and that's such an important value, right? It goes back to the same point that's been coming up throughout our terrific conversation tonight, is about caring and empathy and compassion for your neighbors and for our communities and for other humans.
And you talk about caring. I was stunned when my daughter, who's at the local high school, talked about taking care of the homeless in Milford.
Yeah.
And I said, okay, I know I'm naive and I look at things with rose-colored glasses or binoculars, as she says. We have homeless in Milford?
You do. Yes, absolutely. There are people experiencing homelessness in places that are all across the Commonwealth, certainly here in Milford. And often those folks are unfortunately invisible. You just don't see them.
You don't see masks and casts. You don't see the San Francisco streets.
Yeah, not to the same degree, for sure. But there are people, especially, as we're still kind of reeling from COVID, not just from a health perspective, but from a financial perspective. We have a lot of people who experience homelessness and housing insecurity. This is actually another area where I have been a really successful advocate because, caring and compassion, I think, and I've heard from droves of people that I represent that everyone should have some basic civil rights, regardless of your housing status. And so but that's not true right now. Right, people who experience homelessness often have a lot of difficulty accessing health care and a lot of difficulty getting to vote, even though they have a right to vote. And, even just sitting on a park bench. And so I filed 2 bills actually in my first term that through the legislative process actually got merged into one. It's called the Homelessness Bill of Rights, and it had been filed several sessions actually before I was elected and sworn in, and then I came on as the lead Senate sponsor in my first term with this additional bill that we called the Act of Living that provides meaningful civil rights for people experiencing homelessness, and also provides that civil rights that are not only important for dignity, personal dignity and respect, but also to help people exit homelessness, right? Get a job, access jobs and access food and access healthcare, access housing. That if you don't have a permanent address can be really, really difficult.
Now, when you talk about voters' rights,
Mm-hmm.
it's hard to grasp the concept that the most fundamental right we have is to vote.
Yep.
Because without that, we can't change anything.
True.
I remember this last presidential election when the former president started screaming, it's rigged, it's fixed. I looked at my darling bride and I said, Trump's going to make it so this is the cleanest election ever. Because if I'm a registrar and I know that this guy's saying I'm cheating,
You're going to make sure.
I'm going to make sure that every single vote
Yeah.
is perfectly counted.
Yeah. Well, I'll tell you, voter fraud is just not a thing. And I've lost count of how many times I've said voter fraud is not a thing, but voter fraud is not a thing. And our town and city clerks throughout the state are really the folks that make elections happen. And they are just phenomenal people. They make our elections work. They are the backbone of our election systems. And they have a lot of my respect. And I've been really focused on listening to the clerks and listening to people who are trying to vote. And, I was the lead author on the 2020 Vote by Mail Act, right, when the pandemic hit and we were really worried about people even being able to safely get to a ballot box. We got to find another way to do it. So, so I wrote and filed the 2020 Vote by Mail Act, and lo and behold, we had a really strong, not perfect, but, nothing in life is perfect. So, but a really strong mail voting system in 2020. We had the biggest turnouts ever in the history of the state, I think.
But that's a good thing.
Yeah, no, it's fantastic. I think it's terrific. And election reform, making sure people have access to the ballot box has been a really central piece of my work. Right, it's part and parcel of that Homelessness Bill of Rights we were talking about a few minutes. Right, I came on, boom, it advances favorably out of committee. We refiled again this session, and it's moving along. It's already in the committees on Ways and Means, and
but I can see that being,
and election. Right, the Senate passed a robust election reform bill back in October.
But Beck, I can see that being a problem because how does a homeless person? I mean, a lot of them probably aren't carrying government-sponsored IDs with them.
There's a different bill on that, actually, that we already passed on identification cards.
See, to me, when they say you can't get an ID card, well, wait a minute. If the objective is to get everybody an ID card, why can't you open up Town Hall on Saturdays and make the ID cards free?
Good question.
We can afford, I'm the cheapest guy in town government, but we can afford to print ID cards.
Yeah.
And give it to people because I can't get into federal buildings. I can't get on a plane. I can't get without an ID.
Right.
So why is it so much of a big deal?
Yeah.
And if people don't have the money for it, we should just pay for it.
I don't have a concern about that, but we also need to make sure that we're providing the kind of infrastructure and support, right? The people who provide those cards have to get paid, right? So there's always logistics to work out, funding to work out, and we keep coming back. The devil's always in the details, but there is a bill that has successfully moved through the Senate now a couple of times to provide identification cards for everybody.
To me, that when you come down to the root cause of issues,
Yeah.
the first one ought to be my right to make change.
Yeah. To vote.
To vote. How do I make change? I vote. Well, if I
Yeah.
can't vote, I'll never be heard.
Yeah. And it's so interesting. I have a bill about the day we hold our primaries, right? Our primary, our September primary, as scheduled in our statutes, is the last one in the whole country. And it gets moved every cycle because the date is just a lousy date, right? It's a bad date. More than half the states, a lot more than half the states in the nation that hold primaries like we do them in late May, early June, that sort of late spring time period. So I have a bill to move ours to the second Tuesday in June because not only is it going to help improve people's ability to get to the ballot box, right, before summer break, before people sort of take off, also helps provide enough time for really meaningful debates in a general election so that the voters can get to know their candidates and make the best kind of vote that they can make and or the most informed vote that they can make. But to the money perspective, it would also allow towns like Milford to say, maybe we're going to move our timing for our local election to align with the state primary. So you get some fiscal.
That would be nice. Maybe we'll get more than 12% of people showing up.
You get some fiscal efficiency, right? Because you're running, one day of an election as opposed to 2 different days, right? A local town election and a state primary day election, and hopefully it'll boost turnout. But it's also why I spend a lot of time, talking with young people about voting and why voting is important.
There are so many more topics I want to get to. Unfortunately, Becca, I'm from Milford. Why should I vote for you?
Because I've got the experience to deliver, and my leadership and delivering on those results is proven in the track record, even in just a short amount of time that I've already been in the Senate. Because I listen with my head and my heart, and because I center the people's voices in my work. And like I said, I have been delivering results since pretty much before I even walked in the door, and I'm going to keep delivering results for you.
Well, you're off to a heck of a good start.
Well, thank you very much. It's such a pleasure to join you, and I hope we'll be able to do this again soon. I'm having a great time.
We'll wait till summer, before the end of summer, when everybody's coming back, before the election.
I look
have
forward
you
to
back.
it.
We'll finish up on the other topics. But
sounds good.
More importantly, the first step is to show up. And I've seen you around, and that's a great sign.
Well, I appreciate that very much, and I look forward to seeing you again really soon at Milford Days, if not before, and Milford Day singular, and and thank you again for having me on. I look forward to being a good servant to public servant to Milford.
And always, this is a preliminary. Our election's coming up. I've always said I'll never ask any of my 6 loyal viewers to vote for any particular candidate, but I'll beg them all to get to know the candidates. Pick somebody who you feel comfortable with, that has the same values as you do, and then please get out and vote, because that's what makes the difference. Thank you for everything you're doing, and to our 6 loyal viewers, may God bless, and may tomorrow be a better night than tonight. Thank you.
Not too long since I've been home. Been running all my life